Diabetes is a global health problem. Globally, the projected prevalence of diabetes is rising at alarming rate, from 451 million patients in 2017 to 693 million patients in 2045. The majority of these projections are in low and middle income countries. In addition to clinical manifestations, diabetes causes a significant economic loss. Therefore, in addition to clinical outcomes, economic information relating to clinical status should be also of concern to health practitioners. I am Dr. Athor Rillphaiboon from the Division of Social and Administrative Pharmacy, Department of Pharmacy, Faculty of Pharmacy, Mahidol University. I am going to talk about research conducted as a thesis of the Master of Science program in Social, Economics and Administrative Pharmacy. The student is Ms. Wawa Khieng U from Myanmar. We work with two co-advisors, Dr. Siraphorn Yangkong from the Faculty of Pharmacy and Professor Dr. Koko from North Okalapa Hospital, Yangon, Myanmar. This study was decided as an incident-based cost of illness study, employing a bottom-up approach to estimate the treatment cost or direct medical cost of hospitalization episode of type 2 diabetes patients, as well as to explore the effect of complications. The study was conducted at the North Okalapa General and Teaching Hospital with 800 beds in Yangon, Myanmar. The cost included cost of medication, investigation, specialist, emergency care operation, blood bank services, and routine services. The cost of each service was computed by multiplying the number of services used with their unit cost. The unit cost of medical services used in this study was from the cost analysis of the study hospital. We found that the average total treatment cost per admission was $719 at 2018 prices. This is approximately half of the per capita GDP of Myanmar. In multiple regression analysis, we found that we can save $277, $308, and $320 per episode if we prevent complications of diabetic foot, diabetic nephropathy, and diabetic retinopathy, respectively. Based on the prevalence of the complications, if there are 100 admissions per year, and 50% of complications are prevented by 5-year prevention program, the hospital would save $38,075. The research was presented at the conference of the Professional Society for Health Economics and Outcome Research in Copenhagen, Denmark, or ISPOR Europe in 2019. Then it was published in the journal When You Health Regional Issue in 2021. The title is How Economic Analysis Increased the Awareness of Clinical Services, a case of diabetes mellitus at a teaching hospital in Myanmar. In conclusion, providing economic outcomes relating to clinical outcomes, showing how much we can save when complications are prevented, would increase concern for the improvement of clinical services. If you are interested in the research, you can scan QR code or send a request to my email.